structure, but it'll become part of the MU healthcare system.
None of this will change the cost of like healthcare accessibility or anything.
No, the whole goal here is to expand care and gain the efficiencies of a larger system, right? So again, cost of healthcare is high on mind for all of us all the time. So that's not a new initiative, but it is to reduce generally, in general, reduce the cost of healthcare across the country.
Was there a cost to do this? I mean, is MU buying part of the hospital?
This was not a financial transaction. It was really extending a 25-year relationship to grow both and to supplement both.
Okay. Any other questions for Nim before we let Gasper speak? Okay.
Thank you.
And again, just whoever's asking you the question, you address them directly and don't report up the camera.
Okay. You guys ready?
Joe, I mean,
Yep.
would you be open to coming more over here so that maybe they don't have to turn that way? Sorry about that.
You guys all ready?
Okay, well, Gasper, I guess the main question is, how is this going to benefit Capital Region?
Well, this is an exciting day for Capital Region and in our history. We've had this relationship with the university for 26 years. So it has already demonstrated value to our community and to our employees having this relationship. But by taking this next step, we really can take that next step towards improving care even more. And being a seamless organization allows us to really focus on our patients, to expand services, to expand upon, kind of the offerings that we have here and deliver care in the best fashion that we can for our community.
Now, believe it or not, some of your employees have already contacted KRCD and said they were actually excited about this. Maybe explain how are they going to see better benefits? Are they going to see better pay?
This is an approach that we're taking, that our board of directors, that MU Healthcare is taking, has been a very good approach in the sense that we are trying to put our employees and our patients at the front and center of every decision we make. So the first stage is really July 1. We become officially part of MU Healthcare, but a lot of things don't change here, and that allows us time to really visit with our employees, visit with the community, visit with other stakeholders to try and make those kinds of decisions. And the expectation is that around the first of the year, we'll have those answers for those folks.
Is this way overdue? Do you think this should have happened a long time ago?
That's a great question. I think so. I think if you talk to my predecessors back in 1997 when the affiliation agreement was put in place, they would have probably been surprised that it would take 2023 before we actually fully became integrated. I believe that this was actually the intention at that time. And as we've talked in other formats, and Nim mentioned before, healthcare landscape is changing rapidly. We are needed by our community. We are here for the community. And this integration and becoming one with MU really allows us to do that in the best fashion for everybody.
Kind of going off of that, after 20-plus year relationship, I guess why was now the time to take that next step?
I think it's really just the rapidly changing environment of healthcare. Every industry probably says that. It's hard, it's tough, there's obstacles, et cetera. Just last week, BJC Healthcare and St. Luke's out of Kansas City announced a relationship that's similar to what we're doing. Those are two very, very big systems, very successful systems, and we've been very successful along with MU Healthcare. But we have to look to the future. We have to make sure that we're here. We have to make sure that we are providing the services that are necessary for our community.
In 2018, MU Healthcare looked at buying St. Mary's Hospital and making St. Mary's and Cap Region kind of a two-piece operation in Jeff City. One would provide certain services, one would provide another or other services. Do you think that failure, for lack of a better word, to buy that hospital kind of has resulted in this expansion of services within Cap Region?
I can't really speak to the SSM transaction. All I can speak to is really what's been happening here at Capital Region, and that relationship has been strong since the very start. We mentioned earlier we've had those kinds of successes here with orthopedics and ENT and other services, but by allowing us to be one entity, we can really eliminate some of those barriers that just exist with, corporate structures, if you will.
What other services do you see coming here with this new?
That's going to be an ongoing discussion, and it has been an ongoing discussion. I can tell you that we are looking at expanding cardiology services as we speak. Electrophysiology, we are recruiting an electrophysiologist in conjunction with the university. We're looking at spine services. We're looking at all services, and we're doing that jointly. We're doing those kinds of planning jointly to really take advantage of our resources. Resources are very, very critical, right? And they're few, but when you're working together, you can do more. And I think that's really the goal here.
What are you hearing from clients from the local counties, Cole, Miller, Monotone?
Well, we just announced this morning,
But I'm saying,
Joe.
the
So
need.
I'm not sure I have a good handle on that.
But there is a need,
yeah.
obviously they may have said, there's a reason you're doing this, right? So.
Yeah, I think the response has been positive. MU Healthcare has been a part of our community for years, and the University of Missouri has been in everybody's fabric here who are show-me-born people. So, it's a natural kind of relationship. It's the next step for us. It's allowing more access. It's allowing more services. It's allowing more sustainability mutually. It's good for Columbia. It's good for Jefferson City and the entire region that we serve.
And I guess what I'm saying is patients, they've probably told you they don't want to go to Columbia for these services.
Right.
At all possible.
I think that's a personal decision, right? Healthcare is one of those decisions that is a personal decision, and so people have physicians that they like that are in certain areas they're willing to travel. I think by providing options here in Jefferson City that are consistent with Columbia, that's a good thing, right? There are certain things that a community hospital probably doesn't need to do and shouldn't do, and those services are 30 miles away. I mean, we're super lucky to have a children's hospital 30 miles away, and it's a beautiful facility that they're building. That's an asset for all of us. By us being one entity, that seamless care really can be improved, and that's what I think is a benefit to patients in the community.
It says right now non-binding letter of intent, and it's subject to the board's approval. Is there any chance that it doesn't go through, I guess, for whatever reason?
I can't really comment, but what I can say is that our board is extremely supportive. I know that the University of Missouri is extremely supportive, and everybody's intent is to go forward with this. But we do need to finalize some details, and that will be coming in the forthcoming months.
Any other questions? All right, thank you.
Okay.
Thanks for talking.
Get hot in here.
Well, you're the one.
You guys, I mean, they were doing,